Skin permeation enhancers. Skin permeation enhancers, ionotrophorosis, electroporation, radiofrequency, laser radiation, microneedle based devices, skin abrasion, skin puncture, needleless injections, suction abrasion, ultrasound devices. These are used to skin permeation enhancers. Skin permeation enhancers. In this method, the ionotrophorosis, laser radiation treatment, radiofrequency, electroporation, microneedle based devices, skin abrasion method, these are used to increase the skin permeation. Okay. Ionotrophorosis. Ionotrophorosis. In this method, it involves the application of low-level electric current either directly to the skin or indirectly via the dosage form to enhance the permeation of topical skin. For example, some oral route and parental route, these are the other routes to give the indirectly dosage form of drug to enhance the permeation of the skin. Okay, and to increase the drug permeation as a result of the methodology can be attributed to either one or a combination of the mechanisms: electrorepulsions, electroosmosis, electroperturbation, and some parameters that affect the design of ionotropic skin delivery system, which include electrode type and current intensity. These are the some types. The reported limitations of ionotrophoretic system include amount of electric current that can be used in humans, irreversible damage. Such currents could be barrier properties of the skin. In addition, ionotrophoresis has failed to significantly improve the transdermal delivery of macromolecules. For example, when we applying the ointment or creams or gels to the skin or topical layer of the skin, in that time, to increase the permeation of the skin, in those times these ionotrophoresis method is used to increase the permeation of the skin. Okay. And the second process, that is nothing but electroporation. Electroporation means, in this electroporation, the high voltage pulses are involved to induce the skin perturbation. Here, okay, these methods used to increase the skin permeation. Okay. But in the electroporation, when we applying the high voltage of electric current to the skin, it decreases the skin perturbation. It has been proposed that transient pores are generated during electroporation. Increase in skin permeability, which leads to the electroporation. The electroporation method increases the skin permeability. High voltages and short-term durations are most frequently employed in this method. Other electrical parameters which affect the delivery of dosage, which include pulse properties such as waveform, rate, and number. The technology has been successfully used to increase the skin permeability of molecules with different lipophilicity and their sizes. Nothing but small molecules, proteins, peptides, and oligonucleotides. These including biopharmaceuticals with a molecular weights that is not exceeding to 7K daltons. The current limit for the ionotrophoresis is 7K daltons. Okay, this is about the electroporation. This is one type of method to increase the skin permeation. Third method. In this method, the device consists of a drug reservoir and plurality of projections. Microneedles of length, which is nothing but 50 to 100 nm. The microneedles are extended from the reservoir that will penetrate the stratum corneum, nothing but skin, and epidermis to deliver the drug. To deliver the drug into the skin, the microneedles are injected into the skin outer layer, that is nothing but stratum corneum. The various embodiments of the invention include use of membrane to separate the drug from skin, and it controls the release of dosage form. The reservoir may contain drug, solution of the drug, and the gel or any solid particles. The length of microneedle is 50 to 200 nm. This is mandatory, and the micro projections are microneedles which create the channels in the skin which allow the movement of topically applied drug. Clinical evaluations report that minimal associated discomfort and skin irritation and erythema rating associated with the system, which is reportedly low. This technology serves as an important and exciting advance in transdermal technology due to ability of the technique to deliver the medicaments with the extremes of the physiochemical properties, which includes vaccines, small molecular weight drugs, and large hydrophilic biopharmaceuticals. And fourth method which is used to enhance the skin formation is skin abrasion. These abrasions technique include direct removal or direct disruption of the upper layer of the skin to facilitate the permeation of topically applied medicaments. Some of these devices are based on the techniques which is used by the dermatologist for superficial skin resurfacing. In this treatment, the acne, scars, hyperpigmentation, and the skin blemishes will be removed. These skin abrasion method, the delivery potential of the skin abrasion technique are not restricted by the physicochemical properties of the drug. Okay, and then fifth method, it is used to enhance the permeation of the skin, is skin puncture or skin perforation. These devices include use of needle like structure or blades, okay, that disrupt the skin barrier by creating holes. By creating the holes, the needle disrupt the skin layer and cuts as a result of movement when it contact with the skin, and similar to microneedle devices produced by the microfabrication technology. The next method is needleless injection. In this needleless injection, the pain-free method, it is a pain-free method. It is also called as jet injection. It is not having a needle, okay, and it is a pain-free method of administrating drugs into the skin. In this method, the drugs will be administered into safely and fearless, and pain will be less when compared to the microneedle based devices. And to deliver the drug in transdermal transdermal route. This method is perfect to inject the drug into the skin. The solid particles at supersonic speeds through the outer layer of the skin by using a suitable energy source. Problems facing needleless injection that include high development cost of both device and dosage form. Because it is a painless method, so that's why the injection will be high cost and the drug also in the high cost. This is a safe procedure and it is used in so many other countries like UK, Europe to program or to control the drug delivery of injections in difference in skin permeability. In addition, the long-term effect of bombarding the skin with the drug particles at high speed is not known. For regular administration of this drug, this method is not suitable because this is the method which can be do in once a week. Okay, it may however be very useful in the administration of medicaments that do not require frequent dosing, like for example vaccine. This is not like the vaccines. Okay. Another method to enhance the skin permeation, that is suction ablation. The formation of suction blisters, which involves the application of vacuum or negative pressure to remove the epidermis while leaving the basal membrane. The method is removing the skin barrier, also referred to the skin erosion. Skin ablation, also called as skin erosion. Skin dermal invasion is avoided. Such discomfort as pain and bleeding reportedly are not associated with this technique. While suctioning the skin, bleeding will be happen. So the disadvantages are of this suction method include prolonged long length time and bleeding will be happen, while there is no risk of systemic infection when compared to the intravenous catheters. This suction method cannot be ignored even though effects might be less serious. Another method, that is ultrasound method. This ultrasound method also called as sonophoresis and phonophoresis. In this, ultrasound involves use of ultrasonic energy to increase the transdermal delivery of the solutes by either simultaneously or via pre-treatment. And this ultrasound method treatment is used for all known to precutaneous absorption, with frequency being most important. Although the frequency have 20 kHz to 16 mHz have been reported to enhance the skin permeation. This is the one type of method which is used to increase the skin permeation enhancer. The mechanism behind to increase in skin permeability is attributed to formation of gaseous cavities within the intracellular lipids to expose the ultrasound, resulting in disruption of the stratum corneum.